A new report has put a price on the Territory's big drinking culture. Figures from 2005 show alcohol-related harm cost the Territory more than $500 million. That's almost 7% of the Territory's gross product for that year. The Territory government says the figures should spur public debate on the need for a raft of alcohol reforms. But health professionals and police are asking Territorians to start making changes now. Former longgrasser Neil Files is visiting one of his old campsites near Lameroo Beach, just below Darwin's Esplanade.
If you go into their office, they've got an office here. You don't
The reformed drinker is using his experience of living rough to help other alcoholics get their lives together.
I was averaging about 30 cans of EB a day, and I was drinking a couple of bottles of whiskey a week.
Neil Files started drinking when he was 12 years old at a pub run by his parents. He qualified as a chef but became a serious drinker. That led to a long string of job losses and 4 years living in the long grass.
Well, basically, I'm an alcoholic. I drank myself to such a stage where I couldn't afford to pay any accommodation because I needed the alcohol to keep myself going.
Territorians are amongst the heaviest drinkers in the world, consuming 15 litres of pure alcohol per person every year. It's a habit that's taking a terrible toll.
I know we drink a lot in the Territory, but to find that we were going along at 3.5 times the death rate for the rest of the country is really a cause of concern.
The Territory's drinking problem comes with a hefty price tag. An economic report using figures from 2005 shows the Territory had 120 alcohol-related deaths, with liver cirrhosis, car crashes and suicide the biggest killers.
The bottom line cost to the Territory economy in 04-05 was $642 million. Now that works out at about $4,200 per person over the age of 14, and about 41% of police and crime costs were related to alcohol.
Last year in the Northern Territory, there were 54,000 occasions where somebody was taken into protective custody.
Get off the road now. Move off the road.
Now, protective custody means that the person was so intoxicated that they couldn't take care of themselves.
Alcohol-fuelled violence accounted for more than half of all murders and assaults in the Territory last financial year. This year, policing alcohol-fuelled crime will cost more than $100 million.
There has to be change. There is no doubt about it. Whether we like it or not, we can't continue to see the same level of trauma on our roads. We can't see the same number of people who present at the emergency departments in our hospitals seeking treatment as a result of alcohol-fuelled violence.
Those at the coalface dealing with the health impacts of alcohol abuse are also calling for change. Darwin is the broken jaw capital of the world. The Royal Darwin Hospital performs up to 300 facial reconstructions a year, and almost all are alcohol-related injuries.
We've had people come back to us with a facial fracture for the second time, for the third time, after we fix them up. And the Indigenous people are definitely overrepresented.
You cut behind your ear there. Yeah.
Indigenous people suffer more alcohol-related harm and deaths than non-Indigenous Territorians.
I'm ready. All right, hold on, we're going to need...
On average, Indigenous people drink more than 16 litres of pure alcohol a year, while non-Indigenous people consume about 14.
How long ago this happened?
Both rates are significantly higher than the national average of just under 10 litres.
The more evidence we have, the more information we have that goes out into the public debate that proves the case for a further raft of alcohol reforms, the better.
In the Territory's remote Indigenous communities, tailored alcohol management plans have had some success. There have been reductions in alcohol-related harm and crime, but experts say a Territory-wide plan is needed.
Looking at all aspects of the problem and for the whole of society. The data seems to make very clear that this is an issue for all Territorians, Aboriginal and non-Aboriginal, and so the solutions really need to cover the whole of society and in all of its different ways.
We've done more than any other government in the nation. No other government has the comprehensive alcohol management plans we've put in place. No other government has the tough penalties we've got in place. No other government's gone to dramatically expand clinical support services like we have.
Yeah, you will be, pal. Come on.
2 out of 3 arrests, assaults and homicides involve alcohol.
But strong advertising campaigns and alcohol levies have been used effectively by previous Territory governments.
The Territories had enough.
In 1992, the CLP government of the day implemented a Territory-wide alcohol management plan that reduced alcohol consumption by more than 20%.
I didn't know it then, but I'd been hit by a drink driver.
A very successful programme. The evaluation indicated that there were nearly 130 fewer deaths because of the Living with Alcohol programme, and we had nearly 1,400 fewer car accidents, 1,300 fewer people admitted to hospital.
The programme introduced a levy on alcohol, which saw people paying more for drinks with higher alcohol content. The proceeds fed back into treatment and education programs tackling alcohol abuse. But in 1997, a High Court challenge saw changes to national taxation laws, and the levy was scrapped.
The taxation was stopped, and eventually, so that extra price levy was gone. And of course then eventually the dividend, the health dividend that increase in tax allowed also went, so we saw the programmes begin to fall away.
While the race is on for the federal election, the Territory government won't be making any broad alcohol reforms, but change is needed, and economic and social benefits have been proven.
We might have saved 108 million and 18 lives. That's what the report estimates might have been saved in that year if we'd had a comprehensive range of measures in place.
At the end of the day, government can do so much. People themselves need to change the way they're living their life.
Neil Files has already made that decision for himself. After rehabilitation with the Salvation Army, he stopped drinking and is now helping others to do the same.
Hi, Neil.
Until you hit rock bottom, you're not going to stop. But this time I said, I've got to stop, and that was the difference. My life seems to be running smoothly, things are in place, things are beautiful.